Hello, my name is Caitlin Palachek and I'm with Cook County Health. Thank you for joining us today. If you need help with an appointment or have a medical question, you can reach our health system at 312-864-0200. My guest tonight is Dr. Toyin Adeyemi, who is the Senior Director of HIV Services at the health system. Welcome to the show, Doctor.
Thank you, Caitlin.
So our doctor today is one of the clinicians at our Core Center clinic. Do you want to tell us about the Core Center, where it is, what it is?
Okay, so the Core Center is one of the clinics in the ambulatory health system of the Cook County Health, and it is a standalone clinic for the prevention and care of infectious diseases. It's located right here on the west side at 2020 West Harrison, right at the corner of Harrison and Damon, and it's celebrating its 20th year this month. We'll talk about that later, but it's a center for the care, prevention, and research of infectious diseases, one of the many clinics in our ambulatory health system.
Nice. And how many people work there?
Oh, well, at the Core Center, we have about 200 people who work in that building. And really, we talk about primary care and specialty care providers, but at the Core Center, because of our patient-centered medical model, which is what the model is in all of our ambulatory clinics in the health system, it is important to talk about all the people that actually provide care in the building. So the prescribers, I would say we have about 65 to 70 providers who do either primary care or specialty care in the building. But in addition to that, we have a large group of people who do a lot of services, including care coordination, social services, mental health, counseling, pharmacy, all of that in the building. So about 200 people, of which about 70 are prescribers, and the rest are all part of the team-based care to get the outcomes that we get at the Core Center.
Thanks. And can you talk about the types of clinics that are in the Core Center?
Awesome. And this is, so the Core Center is primarily a clinic for infectious diseases.
Okay.
And sometimes people hear infectious diseases and think the Core is all about HIV. So the vast majority of the patients we provide care to are HIV infected, but we do a lot more than that. And that's something that people aren't always aware of, that at the Core Center we have HIV primary care clinics every day, Monday through Friday. We also have specialty services. So in addition to primary care for our patients living with HIV, we have all the specialty services in the building. We have, nephrology, neurology, dermatology, we have dental services, we have pulmonary, we have a lot of services in the building, but we also do provide care for people who are not living with HIV. So we do a lot of services. We have a walk-in screening clinic, which is open 5 days a week, where people can come in for STI testing. No insurance needed. You can walk in for testing, either for symptomatic or asymptomatic STIs. We have PrEP services, which is prevention, which is taking a medication to prevent your risk for HIV. We also do have dental services. We also have a lot of patients who come in because they need a lot of the social services that we offer. So case management, mental health, substance use treatment, all offered in the clinic. So yeah, in addition to primary care HIV, we provide care for viral hepatitis. I direct the viral hepatitis clinic, and in the last couple of years we actually have more patients that we care for who do not have HIV, who are coming in for viral hepatitis C, hepatitis B. We do the infectious diseases. We also have an OPAT clinic, which is outpatient antibiotic therapy for people who have infections treated in the hospital and are followed on long-term antibiotics in the clinic. So it really is a model for the care, prevention of infectious diseases. We also do research. So because of being part of a system where we're looking at research, education, and treatment, we also do both clinical trials, observational studies, clinical studies, all at the Core Center.
And how many people would you say come into the clinics per year?
Oh, wow. So every year we see probably more than 43 to 45,000 visits a year, not necessarily individual patients. We have about 5,200 people living with HIV that we provide primary care for in that one building. We also have about another 4,000 patients who come in for specialty care visits. Some of them end up having HIV, some of them are primarily viral hepatitis, OPAT, STIs, and then we also do have thousands of patients who come in for screening visits. Every month in our STI walk-in clinic, there's anywhere between 400 to 500 HIV tests done every month. rapid HIV testing.
Wow.
So everybody who walks in for an STI screen, asymptomatic or not, we actually prefer when people come in asymptomatic, right? No symptoms, you just want to get checked out. The health educators do the counseling and the rapid HIV test even before they walk into a clinician. And some people just want to come in for an HIV test. They don't want to do the whole process. A lot of people come in thinking, I want to get a test for urine, gonorrhea, chlamydia, but before they even, as soon as they're registered, we have protocols in place. They get a rapid test, their results are there, within 30 minutes, before they even see the clinician. Within 10 minutes, a lot of times they can get results. So we really do a lot of walk-in visits for people to come in and also to be able to access PrEP.
Nice. Can you talk about the STI epidemic?
Yes. So unfortunately, the number of STIs that we're seeing nationally and in the state of Illinois and in Chicago and the county of Cook has been going up. So that number has gone up consistently for the last 5-6 years. Chicago and Illinois kind of always in the top 5 for, gonorrhea, chlamydia, syphilis. And it really has it's always been on the attention of for the Center for Disease Control, but more recently, a couple of months ago, they actually sent out a Dear Provider letter to all providers in the U.S. saying, these numbers are going up, and we really need to start thinking about other innovative ways to actually get people coming for screening and testing because the numbers have gone up. So even, in 2017, which is kind of the most recent data because we're still in 2018, the data is always a little behind. In 2017, they had close to 2 million chlamydia cases, new cases, more than 500,000 gonorrhea cases and an increase in syphilis cases. All of those have gone up from anywhere from 20 to 60 to 70% every year compared to 2013. So in the last 5 years, we've seen an increase in STIs. We've seen that increase in the city, we've seen it in the state. And most of the cases in the city come out of the city of Chicago. So most of the cases, 50 to 70% of all the STIs come from Chicago. And Chicago is actually one of the top cities in terms of STIs nationally. So we really do need to start thinking about other ways. And there are some things that we're putting in place within the health system to address that. But the numbers are going up. And it's important to say that more than half of these cases are happening in the 15 to 24 age group, right? Mm-hmm. So this is an age group that is not traditionally in healthcare if they're healthy otherwise, and if they're not symptomatic, they really, really are not thinking about it. So we have to figure out 15 to 24. How do we get them screened and tested and have that be part of their lingo is, STI, talking about it and getting screened, but also concerning is the fact that congenital syphilis is going up. So this is syphilis where a child is born and is infected with syphilis, which does have, implications for the child. And you would think that something as simple as screening with a blood test and treating the mother during pregnancy would be something that is happening nationally. We're doing a really good job in our health system, but that's not necessarily the trend nationally. So congenital syphilis is going up. I bet you if you talk to people in the community, people think that syphilis doesn't even happen anymore. It's something they thought happened in the 40s before penicillin and everyone's good now. But those numbers are going up, and because they're going up in people who are in the childbearing age, you are seeing cases of syphilis. But it's also important that while half of those cases of STIs are in the 15 to 24, that older adults are also getting infected. Older adults are sexually active. Sometimes clinicians don't want to think about that. They are sexually active, and sometimes the whole messaging around PrEP and STIs was something that they really weren't thinking about, right? And so, you have people coming out of long-term relationships into second relationships after divorces, or they're widowed, or things end. And so we're seeing another group of adults who are getting infected with HIV and viral hepatitis and STIs. And so really the goal is really to just make sexual health and screening for STIs part of the normal lingo. Because as long as there's stigma around talking about STIs and getting treated, but we also have to make the screening pretty accessible, and we have to make it timely and effective so that people aren't waiting hours to get screened for something they're asymptomatic for. So the CDC is really looking at innovative ways, and I know the health system, we are coming up with initiatives to increase our rates of testing and screening. And in response to the numbers, the CDC has this new campaign, kind of the 3 T's, talk, test, and treat. And so they're talking about STIs, kind of destigmatizing it, testing and then treating, right? And the TTT goes not just to patients. So there's a public campaign around that, talking about sexual health and getting tested because people might be asymptomatic and getting treated, but also to providers, right? So not necessarily those of us who are in infectious diseases, because if a patient already walks into the core center, and the ones who've come there do come back, they refer friends, they know how the process works, they can get tested, they don't have to worry about if they don't have insurance and all that. But the vast majority of people may not know how to access those services, but they go into their primary care provider. So we really need to make sure that primary care providers in our health system and also in other places are really making a sexual health initiative part of what they do in primary care.
Thank you. So can you talk about the core center's involvement with the Getting to Zero campaign?
Yes. So the Getting to Zero campaign is a statewide campaign to get to zero HIV infections. And, is GTZ Illinois. And it really is a goal that by 2030, that we can get to zero new infections in the state of Illinois. And the goal of the modeling that's done by very smart people looking at where we are is that if we can get 20% more people living with HIV in that state suppressed, virally suppressed, undetectable, where they cannot transmit the virus, and we can get 20% more people who qualify for PrEP, right? So pre-exposure prophylaxis to prevent infection, that we can get to a point where we have less than 100 cases of HIV a year. And at that point, the epidemic is not able to sustain itself. So it's not that we won't have a single case of HIV, but when we get to a point where we have less than 100 cases a year, then we can actually get to zero transmissions. And, we actually, this is the best time to think about doing that kind of thing, because we have all the tools we need. We have medications to get people virally suppressed. And when patients are undetectable, and that's something we'd like the public to know, that if a patient living with HIV is undetectable and has less than 200 copies of virus for at least 6 months, they cannot transmit HIV sexually. This is called the U equals U, undetectable equals untransmittable. And we feel like this is a campaign that will help with some of the stigma around HIV and some of the reasons why people don't want to get tested. And okay, what if this happens? Is that if we can get people undetectable and keep them in care undetectable, they cannot transmit the virus. And we can have people access PrEP, so they can take a pill a day to prevent them from getting HIV, that we really can get to zero new infections. So the health system is a partner. So Cook County Health is a partner and supporter of the Get to Zero initiative. I am on the co-chair of the Healthcare Access Committee. So we realized to get to zero infections, the meds are great, but that's a part of a bigger comprehensive panel, right? And at the health system, we actually see proportionally more patients who are at the poverty or below poverty line, who have a lot of these things we call the social determinants of health, right? They have issues with housing, transportation, food insecurity, a higher rate of mental health issues, substance abuse, and all of these things are things where the health system has programs in place to address those social determinants of health. So we really are at the table with the Get to Zero initiative. There are very many members of the county health system who are on different committees of the Get to Zero, people who are at town halls getting notes from patients and constituents. We have people who are advocates, who are policy in the policy development part. So the health system does support the Get to Zero initiative, and we have many individuals who are staff of the county health system who are part of committees of the Get to Zero, and I co-chair the Health Access Committee, because we really have to think about if 2 out of 3 people living with HIV in the state of Illinois are insured by Medicaid plans or underinsured, that the Cook County Health does play a big role. And because we take care of anywhere between one in 5 to 1 in 6 people living with HIV in the city of Chicago gets their care in our health system. We have, between the 5,000 core, we have another 1,000 patients who get care at some of our other HIV sites in the health system, at Austin, at Providence, at Oak Forest, So we do have HIV services both here on the west side and also in other parts of the city. If 1 out of 6 people living with the virus gets care for the HIV in our health system, then we definitely have to be part of the solution to getting to zero. And a lot of things that we have piloted in the health system, initiatives that we have put together in the health system are going to be kind of expanded and routinized to kind of help to get to zero. So I'm very excited. The goal is to have a draft of the plan released on December 1, which is World AIDS Day, open for public comment, and then February of 2019 we come up with a 5-year plan. And the 5-year plan is to make sure that by 2030 we get to zero new infection. So it's very exciting.
That sounds like an exciting campaign.
It is. And it's a partnership with health systems, the departments of public health, IDPH, CDPH, organizations, community-based organizations, faith-based organizations. We're partnering with housing organizations that do law and justice. These are all things that are going to be needed in place, in addition to the medications and the prescribers. But you're getting the theme here that, it's a patient-centered home is what we're going to need, and that's what we do in the health system to get to zero. So it's a very exciting campaign led by the AIDS Foundation of Chicago and kind of bringing everyone together. So we're all going towards the same goal.
That does sound like an awesome campaign.
It is.
On another note, we have a caller.
Oh, okay.
Hello, caller. Go ahead.
Good evening, Caitlin. Good evening, Dr. Toya. How you doing this evening?
Good.
Doing well, thanks.
There you go. I got a question for you.
Okay.
In regards to HPV. You know what that kind of test is, right, doctor?
Yes.
Okay. That girls got to start taking that test when they get their pap smear.
Yes.
And I have a sister-in-law. I believe she has HPV. She's had it for a couple of years now. And I'd like to know if it's contagious or if my brother-in-law could get sick from her. Or could you explain a little bit about HPV?
Okay. So, yeah, you're right. Thank you for calling in. So we talked a little bit about syphilis and gonorrhea and chlamydia, but HPV is also sexually transmitted. Now, a lot of people have HPV, and, there's so many different types of HPV, very, very different types. And some of them are what we call not pathogenic. It's a virus. HPV is human papilloma virus. And some of them are more pathogenic, which means they actually can cause disease. And the disease we always thought about usually was cervical cancer in women, right? So they tested for HPV. But what we do know is that HPV is related to a lot of other cancers, including head and neck cancers, oral cancers. And that was why when the vaccine was recommended, it was initially approved from age 9 all the way up to 26. So, talking about kids getting it at 11, 12, but you can start as early as 9. I have 2 daughters and they both got the vaccine. So initially approved for girls, then approved for boys, and then it was anyone from, boys and girls 9 all the way to 26. It's interesting that because a lot of people have HPV, the thought was that by the time people are 26, most people are already infected, the vaccine wasn't going to do anything. But believe it or not, a couple of days ago, Friday, 3 or 4 days ago, the vaccine, one of them, the Gardasil 9, which is the one that covers for 9 of the very serious HPV strains, was approved to go all the way to age 45. And so that's new information within the last couple of days because they found that there was still a benefit in reducing cancers, especially oral cancers, in going up all the way to 45 and not just assume that anyone who's 30 is already infected. So that's really important. So HPV can be sexually transmitted. If a woman is carrying a very pathogenic strain in the cervical area and vaginal area, it can be transmitted. It can be transmitted and it can cause oral cancers in males. So I don't know how old your brother-in-law is and if he's in that age now that he might benefit from the vaccine because the vaccines now be approved all the way to age 45. But it can be sexually transmitted. A lot of times people carry it transiently. So a woman may have it and then another pap smear, it's not there. It can be cleared on its own. sometimes when people have a weak immune system, if they have HIV, if they're transplant, if they have a weak immune system, they may not be able to clear it on their own. But it's important to know that there's so many strains of HPV, not all of them cause disease, not all of them are pathogenic. So the vaccine does cover strains that are more likely to be associated with disease. And now we have recommendations to go all the way up to 45, which is relatively new.
Thank you so much for calling in.
Thank you.
So, that was really informative. Thank you so much. The Core Center is celebrating its 20th anniversary coming up
Yes.
here soon. Can you
Yes.
tell us about that?
Yes. So we're very excited. So the Core opened in the middle of October of 1998. I started there in July of 1999 as a fellow, so I'm missing the 20-year mark, but it's 20 years, so all month long we're having celebration with our patients, gift baskets for people who come in. We're going to be profiling some of the accomplishments of Core, but on November 1st, we're going to end that month by having a celebration at the Core Center, and really just to honor the staff and the people who work there for a long time, the patients, because it's a patient-centered medical home, and really to bring attention to the things that happen at Core, to talk about the Get to Zero campaign, to talk about our partnership as a health system with the Get to Zero initiative, to come up with creative ways to do asymptomatic STI screening, get more people on PrEP, and get more people virally suppressed. So we think it's really important that as we're turning 20, is also this campaign to get to zero this year. And the matrices that have been modeled by the research crew is that if 20% more people so we have 20% more on PrEP, 20% more viral suppressed, all happening at 2020 West Harrison on their 20th year. But it's very exciting. So November 1st is going to be, but that it really hopefully will be the kickoff of a year-long celebration of the accomplishments of the health system around HIV, the leadership role we're taking in HIV in the city and the state and nationally. The Core Center and the health system is very well recognized, and that will really be a kickoff of this is how far we've come in 20 years. These are the things we're looking forward to, and really celebrating and acknowledging the people who've been there since day one to make all of this happen.
Excellent.
So
we only have a few minutes left. Is there anything else you would like to add?
If there's anything I would like to add, a couple of things. One is to really talk about destigmatizing STIs and HIV testing. We like to tell our patients all part of a comprehensive sexual health, to test for, talk about STDs, get tested even when asymptomatic, take the stigma out of it, and we have initiatives in place to, really destigmatize that and make it part of routine sexual health. We're looking at initiatives to expand STI testing within the health system, and also to really emphasize that at the Core Center, like in the health system, it's a patient-centered home. Our mission is to provide quality care, highest quality care, regardless of ability to pay, with respect, with dignity, with compassion. And the goal is to do all of this while we continue to conduct education and research to the communities that we serve. And that's really important, and that there is more than HIV happening at Core. We're doing primary care, we're doing specialty care, we're doing outpatient antibiotic therapy, we're doing STI testing, we're doing PrEP, and we're providing specialty services now to adults living with HIV who may not get their primary care at the Core Center. So we have partnerships with a lot of FQHCs, and we have patients referred from outside networks for care of their viral hepatitis and other things who are coming to us as a specialty care center. And that's one of the goals of the health system, to expand our reach of patients we provide primary care for, but to be a referral center. And our HIV services and HIV program are a center of excellence. And so very excited about that.
Great, thanks. Well, I sure learned a lot today, and I hope the viewers at home did as well. Thank you all for turning in today. And thanks again, Doctor.
Thank you.
Have a
My
good evening,
pleasure.
everyone.
Thank you.